This Medical Monday is sponsored by the George Washington University Hospital.
This Medical Monday, we're talking about common shoulder injuries, and I'm joined now by Dr. David Lutton, an orthopedic surgeon at the George Washington University Hospital. Welcome to Good Morning Washington.
Thank you. Good morning.
I think this is a topic that so many people at home watching right now can relate to. So let's just start with, what are the most common shoulder injuries that you see?
So that's a great question. So it really stratifies out by age. So my younger patients, a lot of time they're just playing lots of basketball or baseball, and they're just having little overuse injuries. And some of that just needs to be a little bit of time off. As they get into more competitive contact sports, then we start seeing shoulder instability, where people are dislocating their shoulders. And then as we get older and they start getting a little bit more gray hairs like myself, we start seeing more rotator cuff injuries, where you have tendonitis around the shoulder. The rotator cuff is a group of 4 muscles and tendons that circles the shoulder and allows us to position our arm in space. Unfortunately, tendonitis sometimes progresses to partial thickness tears or full thickness tears, and that's where we need to get involved a little bit more. And then as we get even older, sometimes we start developing arthritis. And when we start developing arthritis, then there are other treatments that we have.
So we've heard, hear a lot about hip and knee pain when it comes to arthritis, and we've heard about treatments for that. But when it comes to shoulder arthritis, how is that treated?
So that's a great question. Ultimately, arthritis of any type ends up leading to wear and tear of the cartilage. So we've just lost that smooth, slippery surface on either side of the joint. It's like wearing out your tires on your car. And just like in a hip or a knee, when you develop arthritis, the same thing can be treated with a shoulder, where you end up doing a shoulder replacement. So commonly hip replacements, knee replacements, because they're weight-bearing joints, but shoulder replacements are what I specialize in.
Well, and there have been a lot of advancements when it comes to technology and shoulder treatments. Talk about that.
So when I started practice back in 2009, we were really just using basic CT scans, x-rays, and kind of doing our best to get our implants in the right position. But as technology evolved, we can now use fine-cut CT scans, which really give us really good resolution, so we understand where the bones are, and so we can reconstruct this with incredible accuracy. With a CT scan, we can bring it into proprietary software. We can do 3D modeling. I actually do that with the patients in the office. And then we can use a transfer technology, which really amounts to a custom guide at the time of their procedure, so we can do these incredibly accurately with great precision and reproducibility.
Ultimately making it easier, quicker, and then getting people out of pain quicker.
Correct. And my goal is not to just do this now, but actually to have it hopefully last a lifetime. We want to optimize our ability to make these work.
If people watching right now want to learn more and connect with you, what's the best way to do that?
Best way to do that is to take a look at your screen now. The George Washington University Hospital has their phone number up there. They have their website up there, and this would be a great opportunity to learn more.
Excellent. Doctor, thanks so much for being here today.
Thank you. Appreciate it.